What is one of the fastest growing aesthetic procedures in the United States today? It's non-surgical vulvovaginal rejuvenation. It seems like everywhere you turn there's a new device or a newly marketed indication for this technology, but it's somewhat controversial. Just last year, the American Society for Dermatologic Surgery debated whether or not it should be included on the scientific program. Some felt that it was part of female genital mutilation, and others felt that it's outside the scope of practice of a dermatologist. When you're evaluating a patient for the first time who has these concerns, it's really important to take a detailed history. You want to make sure that they're not currently pregnant. This would be contraindicated in those patients. You also want to ask about sexually transmitted diseases such as HSV history. You also want to know if they've had any prior vaginal surgeries before commencing with treatment. It's also important to find out why they are interested in the therapy. Is it because of the external appearance of the labia? They might benefit instead from labiaplasty or an ablative resurfacing laser as opposed to some of these internal treatments. And what symptoms are they having that brought them into the office? You also want to do a physical exam. You want to make sure that your patient has laxity and not prolapse. So cystocele and rectocele are two advanced conditions that would not be treated with non-surgical techniques. Those would be referred to urogynecology for further management. Histologically, a normal vaginal wall has mucosa and muscularis, and what we see with age is that there's atrophy, the outer layers and also the muscular layers just relax. Many of the devices that are available use radiofrequency technology. Some are listed here. They're monopolar, bipolar, and unipolar variations. Things like Protégé Intima, Revive, Thermiva, Vivive. So this particular device treats in 360 degrees. Some are not. Some actually have to manually be turned to treat the entire vaginal mucosa. Immediately after a treatment, you do see some vasodilatation, angiogenesis, and later you get collagenesis. So the evidence about these devices is a little lacking. Most are small case series. Most have very limited follow-up, 6 months to 12 months. Many are not controlled, meaning there's not a placebo group, and some of the questionnaires or patient-reported outcomes are not validated. So we really don't have a ton of evidence surrounding their use. There are probably more laser devices that are used for this indication as well. Some are carbon dioxide lasers, erbium YAG lasers, intense pulse light, and also some hybrid lasers. And like the radiofrequency counterparts, the evidence still is a bit lacking. But there is a lot of anecdotal evidence that these radiofrequency devices and these lasers both result in some subjective improvements in laxity and stress urinary incontinence. We do need to do further studies to determine how long or how long-standing these improvements can be seen. There currently aren't standardized protocols. Each device is slightly different, and they're going to have just slightly different treatment parameters, and studies comparing devices are lacking. But whether we're ready for it or not, non-surgical vulvovaginal rejuvenation is here, and I would just be interested to hear what people's thoughts are.